Save yourself time by searching and researching and browse through our holistic medical database with the integrated AI Sana on Wikisana. AI Sana is a comprehensive database where all the broadcasts of our guests have been transcribed and transferred to the AI to support you with your individual health questions.
A warm welcome, dear viewers, to the format Experience Medicine. I am pleased that you are joining us again through the show. And I have invited Dr. Heinz Lüscher as a guest today for a, not so simple topic. It is about cancer diseases, but of course, it is also about how we can effectively address these conditions. And he is an expert. He is a practical doctor and orthomolecular physician and can give us some valuable information on this. And now I warmly invite you to follow us in conversation. We will get started shortly. Dear Heinz, it's nice that you are back. Thank you very much for coming.
Gladly.
So today our topic is not exactly light fare, cancer prevention. For many, it's still such a boogeyman, which I can understand. And it usually causes fear because it's always somehow associated with death. So it actually feels like a death sentence when you receive the diagnosis. But it doesn't have to be. We actually have possibilities to confront this and to support the body accordingly. That's why the title of the show is Micronutrients in Cancer Prevention. So we're actually taking a step ahead so that cancer doesn't even develop in the first place. May I first ask you, what does conventional medicine say about the development of cancer? And how does this differ from the perspective you have as a complementary medicine practitioner on cancer development?
I believe medicine places a lot of value on genetic factors. We estimate about 100 so-called oncogenes. So these are gene mutations that promote the development of cancer. They are also being sought after. Many of them can be proven. And that is basically the cause. One gene has mutated, and now during cell division, 6 cells are being created. That's how cancer comes about. This is today's most accepted theory behind its development. I personally see it a bit differently, because already 100 years ago, Otto von Warburg actually proved that cancer cells feed on glucose. I believe next year we will celebrate 100 years. He received the Nobel Prize for this, and then this theory disappeared again. And in the 1980s, there are excellent studies by an American, Seyfried, whose first name was not mentioned, Seyfried. And he has actually proven convincingly for me that cancer is a metabolic disease. But this is, of course, contrary to the mainstream in conventional medicine, where genetic causes are seen as predominant. And shortly afterwards, 2-3 years later, a medical doctor received the Nobel Prize, who had brought the genetic genesis to the forefront. And since then, it has been that way. But there is actually no research on the causes. The entire research focuses on new medications. But research into the causes. Where does cancer come from? What can we do to prevent it? I don't hear a word, not even from the oncologists. One acknowledges that cancer is becoming more frequent, but no one asks why. That bothers me. I want to know why. I don't have the answer either, but there are a few factors that we could take a closer look at.
You mentioned in the preliminary discussion that you have also been confronted with very specific forms of cancer in your practice recently. Can you repeat that?
Yes, that has always been the case. But among us, it is estimated that a quarter of all patients are cancer patients. We have hundreds of cancer patients with us for many years. We attract them because the cancer patients, yes, they know exactly. In the hospital, I get surgery, chemotherapy, radiation. And practically all, even the oncologists know this. 80% of all cancer patients seek an alternative or something to go along with it that helps them because they feel somewhere that just chemotherapy alone is somehow too little for me. I want to add something. And that's where our offerings come in handy. We know the micronutrients, how we can prevent cancer as much as possible, and of course also how we can treat existing cancer. Now you ask about special forms. Maybe it's coincidence. With a few, I had a tongue cancer, I had a nasal cancer, I even had a heart tumor, which not even every doctor sees once in a lifetime. There are indeed strange. Now I have a new one. This is a chordoma, which is a sarcoma of the sacrum. I have never seen that in my life. There are crazy forms of cancer, but the most common one is clearly breast cancer in women and prostate cancer in men.
You hinted earlier that there are a few factors that are simply predisposed to lead to a cancer diagnosis. Which ones do you see?
I go back to Otto von Warburg, the cancer cell's life from glucose. What does our modern diet consist of?
A lot.
Glucose is not just sugar. When I eat bread, when I eat pasta, it gets broken down into glucose in the body. So in the end, whether I ate a sweet or a plate of spaghetti, glucose arrives in the blood. That is the mega nutrient for cancer cells. What also bothers me here is that many oncologists say that diet has nothing to do with cancer at all. They can eat whatever they want. It doesn't matter. I can show the contradiction. There is this PET-CT, an examination to find out where the cancer cells are. So let's assume you have breast cancer. Before you are operated on, they want to know, has it already metastasized? If your lung, your liver is already full, then there's no need to operate at all. That wouldn't help. So I want to know before a surgery if it has metastasized. Now I give the patient a sugar solution to drink, which is radioactively labeled. Where does this sugar solution go? Only to the cancer cells. In minutes, the cancer cells are full of this radioactive sugar. This way I can measure the radiation. This is called a PET-CT, so I see if there are cancer cells anywhere else. We use the principle that cancer cells absorb sugar, and the same oncologist tells the person, you can eat whatever you want. That has no influence. I can't comprehend this illogicality.
Yes, me neither. So now at this point, I knew the procedure. I didn't know exactly how it was examined, but now you've explained it. Doesn't get more logical than that.
There are also studies showing that the vitamin D level, when it is very high, the chance of getting cancer, compared to a deep mirror, about 50% deeper.
Ah, yes, okay.
That's another example. If I manage to reduce the amount of glucose in my diet, in my nutrition, then I also have a better prognosis. Or a smaller chance of getting cancer. If I were to implement everything we can do, then the chance of developing cancer is at least 50% lower. But there are also cases where people do everything right and still get cancer. There are simply factors present that we do not know. I would like to research further there and understand why. I have no answers to that. But at least, and that is indeed encouraging, I can reduce my chances of getting cancer by 50%. That wouldn't be nothing.
No, that is not nothing exactly. When you say there are people who do everything right, does that mean their micronutrient supply is also correct?
Yes, people who eat healthily, exercise, do not smoke, do not drink, and still get cancer. That also exists. I stand there and do not know why.
Do you have such patients?
Yes.
And how do you then proceed, or how are they then further supported?
The treatment is the same, but if someone has already done everything right beforehand, how am I supposed to still prevent it? I cannot add anything more here.
That's why I'm asking, what is the next step? Where do we start?
Well, but with these people, it is no longer about prevention, but about treatment. Of course, we can offer something. We have quite a large range. We are not against medicine either. All our cancer patients are also being treated somewhere in an oncological clinic. We always recommend surgery as a rule. If a tumor is that large, it has to be removed. No one can cope with a tumor like that. Not even chemotherapy. It has to come out. Then we still have plenty to do with the rest that might still be lying around somewhere. We support the oncological treatment and we try to collaborate. I just have a child that is receiving chemotherapy at the Children's Hospital. We are providing other infusions along with it. I am in contact with the oncologist. I think that's great. Unfortunately, not everyone is willing to work with us.
I was also glad to see you earlier in the preliminary talk mentions that there are various oncologists where patients say that they are accompanied by wise medicine with micronutrients. That they support this. There are already a few, right?
Yes, there are a few, but it is the minority. The great majority of oncologists tell the patients that it doesn't help anyway. That is the most common statement that the patients bring to us.
But now it is indeed the case that what you do is scientifically based. Why is it so difficult for micronutrient therapy to be integrated into conventional medicine? I have certainly understood that it doesn't play a role in studies. But the findings are already there. Why don't we use them? Unfortunately, I don't understand it. You probably don't either.
No, in the end, I don't know why oncologists are not willing to look beyond the horizon. Each person must decide for themselves. There are, of course, economic reasons that play a big role. If you know what a chemotherapy costs, what an immunosuppressive treatment costs, it is multiple times more than what infusions cost here. Oncological patients are quite interesting for hospitals. But I am not taking a patient away from any hospital. I also want to clearly emphasize here that when alternative practitioners or whoever tells people don't go into oncology, they will only harm you. That is wrong. Oncology is not simply wrong. It is very impactful, and from our perspective, not always optimal. But fundamentally, it is indeed necessary. It is important to me that we try to work together honestly with oncologists. I believe both sides have their validity. Together, we would be strong. In a chemotherapy, I can help people tolerate it better, have fewer side effects. I can also accompany radiation in a way that it becomes very well tolerated. These are all possibilities that oncologists could utilize. It would improve their patient's condition. They do not earn less. The hospital doesn't either. But I only experience this collaboration in exceptional cases.
Sometimes things just take a little longer. Ultimately, the patient still has the freedom to inform themselves well. That is one thing. And then ultimately to say I would like to be additionally accompanied by micronutrients or vital substances.
80% of all cancer patients do that. The oncologists know that too.
Now we are still in cancer prevention. We have titled the broadcast with Micronutrients in Cancer Prevention. We don't actually want to let it come to that. But certainly, we also have one or the other viewers who are already affected by cancer. We have already understood or we have already talked about glucose, and that cancer may also be a metabolic disease. This means ultimately we end up again with the micronutrients, which we should individually substitute in the best way to compensate for the deficiencies that are present in a person.
If you know that glucose, then reducing sugar and carbohydrates is already a first step. Vitamin D. The immune system as a whole is important. It needs to be strengthened. Every person, including you and me, we produce cancer cells every day, several hundred. The immune system recognizes them and destroys them. As long as I have a healthy immune system, the chance that these cancer cells somehow spread rapidly, nest somewhere, and continue to grow, very little. But our immune system is naturally also attacked daily by poor nutrition, radiation, inactivity, etc. Toxins, stress, all sorts of things weaken our immune system. That is probably a major factor that we see more cancer cases. That's where we can start. A healthy immune system is a key in prevention.
And micronutrients play a very big role in that, so that I give the body the strength.
Yes, it's always the same. Vitamin E, omega-3, magnesium, vitamin C, always the same.
But ideally already individually assessed or individually evaluated and not just roughly.
Yes, we can measure that. That's the right way. Scientifically, it's always measure, then treat, and then measure again. I have now corrected these deficiencies. In practice, it sometimes depends on the costs that people cannot afford. Because these measurements are outside of insurance coverage. Measurements that are being paid.
Yes, unfortunately, that's another thing that raises questions. You could invest in prevention. If you finance these things as a health insurer or as a health fund, you could save so much subsequent costs.
I am convinced of that. If we would implement such cancer prevention for all people, in the end, health funds would save millions. But people are indeed also sluggish here. There are few who truly look after their health preventively while they are healthy. Most, the vast majority, only come when they are sick.
Yes. And then you go for cancer screening, and that's again just an examination that determines whether I have cancer or not.
Yes.
And nothing further.
That has nothing to do with early detection. By the time you see breast cancer in the mammogram, it's already as big as a hazelnut. And that is not an early stage.
Yes.
An early stage would be like a pinhead, but you can't see it.
Yes. And especially the intervals between the examinations. Sometimes I also have the impression, okay, I'm going to the examination and there's still nothing. But 2 weeks later, something suddenly forms that might be visible in the mammography.
No, it doesn't happen that quickly.
No?
We assume that a cancer develops over years. 2-3 years, up to 15 years, before it's even detected.
Okay.
So out there, millions of people are walking around who already have cancer, but it wouldn't be detectable with our methods yet. It would be great if we could eventually have a test that could really detect cancer in its early stage at the size of a pinhead. But we are not that far yet.
Well, but all the more important with this statement you just made, all the more important it is to take care of your micronutrient intake and the immune system.
Of course that's important.
Yeah, okay.
But here we often preach to a wall.
Yes, but that's why we keep preaching over and over again, right?
Yes, of course.
Because we've certainly talked about the topic several times, micronutrients, and it's not just you, but also colleagues.
Of course.
On this channel, not just on this channel, but I sometimes think the drop carves the stone, and the more awareness there is, the more precaution may be taken for it.
What concerns me is the question of why it is really always getting more dramatic with the numbers.
Yes, that's true.
I mean, it has always affected children as well. But recently, I've had patients under 40 with cancer. That has happened before. I had such isolated cases 50 years ago. But now they are no longer isolated cases. It is really dramatic. I have 2 patients who were under 40 and passed away in a very short time. Just so rapidly growing tumors. That is really concerning to me. We are also working on that. We are not standing still. We need to continue our education. Every day I want to know more. Whenever I see something new again. There are also methods where I still know too little. For example, hyperthermia. I would like to introduce that, because we know that cancer cells die at about 39 degrees. If we could offer a therapy where we warm the patients up to 41 degrees for 2 to 3 hours, that is a high fever and very uncomfortable. But then cancer cells would die. There are also micronutrients that are applied in treatment. They have at least a cancer-inhibiting effect. That cancer grows more slowly or even becomes smaller. But we are now in the therapeutic area. This is about prevention. I would like to see the number of new diseases decrease. At the moment, the opposite is true.
I just remembered we briefly discussed the topic of the heart, namely IHHT, so the interval hypoxia-hyperoxia therapy, I believe that is correct.
Yes.
Is that also an option to improve the immune system?
Yes, everything has 2 sides. IHHT would improve the immune system and enhance the mitochondria. Let's take breast cancer. In these connective tissues, milk ducts, where cancer develops, you have on average 2,500 mitochondria in a healthy cell. We know that in cancer cells, we only have 500. If we can now succeed in increasing the number of mitochondria in cancer cells with IHHT, then they have much more energy and can become healthy from within again. That's the concept. I also believe that it's true. But now comes the other side of the coin. The enzyme VEF is also produced. This is an enzyme that promotes the formation of new blood vessels in the tumor. I may have increased it by 60%, but it goes back down by 40% due to the downside. It's not a healing method. It's also just a supportive one. We were cautious for a long time and didn't do it. But the latest studies that I've seen are rather positive. If patients wish, we are now offering IHHT for cancer as well.
But we are still in cancer prevention. While it is important to talk about cancer when it occurs, it is also crucial in prevention.
Absolutely great in prevention.
So we have already found some valuable aspects that are offered to you all. If someone says they want to do something for themselves, where can they find you?
We have a medical practice. We are several doctors and therapists in Winterthur, Switzerland. We also have German patients who come to us after such shows. We just have certain waiting times. We can't change that. We have a certain level of recognition. We wait 3 to 4 months, but everyone is welcome with us.
Would you like to say the name of your clinic again?
Weiss Medicine.
Wonderful.
That's a bit provocative. We don't mean to say that the others... Weiss is for wise, the others are not unwise. But I do think that we offer a medicine that really stands a bit above average.
The company name also stands for a vision. If you have the vision that you can set up as wisely as possible right now,
my vision is that the majority of people use integrative medicine, vital nutrient medicine, however we want to call it, first. And that we only resort to medications when integrative medicine has no solution. That would be my dream.
Very good idea. I'm in. So I would like to take this opportunity to sincerely thank you again for your time and for your valuable information. I wish you all the best, and of course to your patients as well. Dear viewers, thank you very much for your company throughout our show. I hope you gained some new inspiration, especially for your health maintenance. Because that's what it was about. It's about cancer prevention. Perhaps you have also become more aware of how important micronutrients are in this whole topic. In this sense, I wish you good health for body, mind, and soul on behalf of my guest. I wish for you to be mindful, vigilant, and loving towards yourself and also towards the world. As always, I look forward to you tuning in again next time. Until then, goodbye.